What to do if you have a heart attack when you're alone? Most heart attacks don't come without warning, we just miss the signs. Long before an emergency happens, the body sends subtle signals through rising blood pressure, silent inflammation, unmanaged stress, and daily habits we think are harmless. This video isn't about fear, and it's not about extreme fitness or perfect diets. It's about awareness, the small, practical choices that quietly protect your heart over years. If you think heart disease only happens to other people, or that prevention has to be complicated, this is a conversation you don't want to skip. Imagine feeling a tight pressure in your chest while the room is completely silent. No one is around. No one hears you breathe differently. No one notices that something is wrong. Heart attacks don't always happen in hospitals or public places. Many happen at home, late at night, or when someone is completely alone. And in those moments, what you do in the first few minutes can determine whether you survive or not. In this video, we're going to talk about what actually happens during a heart attack, how to recognize the warning signs early, and most importantly, what steps can help you stay alive if a heart attack strikes when you're alone. This isn't about fear. This is about awareness and knowing what to do when time matters most. A heart attack happens when blood flow to part of the heart muscle becomes blocked. This blockage is usually caused by a buildup of plaque in the coronary arteries. When the plaque ruptures, a blood clot can form and suddenly stop oxygen-rich blood from reaching the heart. Without oxygen, heart muscle cells begin to suffer damage within minutes. The longer the blockage lasts, the more severe and irreversible the damage becomes. This is why heart attacks are medical emergencies. Not because they are always instantly fatal, but because every minute without treatment increases the risk of permanent heart damage or death. Recognizing the early warning signs. One of the most dangerous myths about heart attacks is that they always arrive suddenly and dramatically. In reality, many heart attacks begin with subtle symptoms that gradually worsen. Common warning signs include pressure, tightness, or pain in the chest. This discomfort may spread to the left arm, neck, jaw, back, or shoulders. Some people experience shortness of breath, cold sweats, nausea, dizziness, or overwhelming fatigue. Importantly, not everyone experiences sharp pain. For some, especially older adults and women, the symptoms can feel more like discomfort, indigestion, or unusual weakness. Recognizing these signs early is critical. If something feels wrong, especially if the symptoms are new, unexplained, or worsening, it's safer to assume it could be a heart attack than to wait and hope it passes. The first and most important step, stay calm. When symptoms begin, panic is a natural reaction. But panic increases heart rate and blood pressure, placing even more strain on an already distressed heart. The first step is to consciously slow down your breathing. Sit or lie down in a comfortable position. Take slow, deep breaths. Focus on staying as calm as possible. This doesn't mean ignoring the danger. It means conserving energy and preventing the heart from working harder than it needs to. Staying calm buys you time, and time is critical. Call emergency services immediately. If you suspect a heart attack, do not try to wait it out. Do not attempt to drive yourself to the hospital. Call emergency services immediately. Paramedics can begin treatment on the way to the hospital. They can provide oxygen, medications, and life-saving interventions long before you arrive at an emergency room. If possible, unlock your door so responders can enter easily. Stay on the phone if instructed and follow their guidance closely. Calling for help early dramatically improves survival rates. Many lives are lost, not because treatment isn't available, but because it's delayed. Aspirin, a simple step that can help if you have aspirin available and you are not allergic. Chewing one tablet can help. Aspirin works by reducing blood clot formation. Chewing it allows it to enter the bloodstream faster than swallowing it whole. This does not stop a heart attack, but it can slow the progression of the blockage and reduce further damage while waiting for medical help. However, aspirin should only be used if it's safe for you. If you've been advised by a doctor not to take aspirin, follow that advice. Nitroglycerin, only if prescribed. Some people with known heart disease are prescribed nitroglycerin. This medication helps widen blood vessels and improve blood flow to the heart. If you have been prescribed nitroglycerin, use it exactly as directed by your doctor. Do not take someone else's medication and do not exceed the recommended dose. Nitroglycerin can help relieve chest pain, but it is not a cure. Emergency care is still essential. What if you feel like you're about to pass out? Loss of consciousness during a heart attack can happen when the heart's rhythm becomes unstable. If you feel faint, dizzy, or suddenly weak, remain seated or lie down to avoid injury from falling. If you lose consciousness and stop breathing, immediate CPR is needed. CPR keeps blood flowing to vital organs until medical help arrives. In public spaces, automated external defibrillators, or AEDs, can restore a life-saving heart rhythm. These devices are designed for non-medical users and provide clear voice instructions. Using an AED as quickly as possible can mean the difference between life and death, why acting early saves lives. Survival from a heart attack is not only about advanced medical technology, it's about timing. Early recognition of symptoms, early emergency calls, and early intervention drastically improve outcomes. Many people survive heart attacks and go on to live long, healthy lives, especially when treatment begins quickly. Waiting, minimizing symptoms, or assuming it's nothing serious is what turns manageable situations into fatal ones. Awareness is prevention. While this video focuses on what to do in an emergency, the truth is that the most powerful defense against a heart attack happens long before the crisis begins. Prevention is not about perfection, it's about awareness, about paying attention to the signals your body sends every day. The heart is not an organ that fails suddenly without warning. In many cases, heart disease develops quietly over years. High blood pressure, elevated cholesterol, unstable blood sugar, chronic stress, and persistent inflammation slowly strain the cardiovascular system long before symptoms become dramatic. The danger lies not in their presence alone, but in how easily they go unnoticed. Regular movement plays a foundational role in prevention. The heart responds best to consistency, not extremes. Daily walking, light activity, and gentle exercise improve circulation, support healthy blood vessels, and reduce the workload placed on the heart over time. Movement doesn't have to be intense to be protective. It just needs to be regular. Nutrition shapes heart health just as profoundly. A diet rich in whole, minimally processed foods supports stable blood sugar, reduces inflammation, and helps maintain healthy cholesterol levels. What we eat repeatedly becomes part of our physiology. Small, daily choices accumulate, quietly influencing cardiovascular risk year after year. Stress, often overlooked, is another silent contributor. Chronic psychological stress keeps the body in a prolonged state of alert, elevating heart rate and blood pressure while increasing inflammatory signaling. Learning to manage stress through rest, boundaries, breathing, or connection is not a luxury. It is a form of cardiovascular care. Routine medical checkups transform uncertainty into clarity. Knowing your blood pressure, cholesterol profile, blood sugar levels, and family history provides a map of your personal risk. These numbers are not labels of failure. They are early signals, opportunities for intervention before damage occurs. Awareness changes behavior. When people understand their risk, they are more likely to move, eat, rest, and seek care with intention. Knowledge replaces denial. Attention replaces fear. Heart health is not defined by a single moment, but by thousands of small decisions made over a lifetime. Emergency response saves lives in critical moments. Awareness saves lives long before those moments ever arrive. Prevention is not about avoiding death. It is about protecting the quality of life that makes living worth it. Heart attacks don't always announce themselves loudly. Sometimes they whisper before they strike. Knowing what to do, staying calm, calling for help, and acting early can give you a fighting chance when every second counts. Share this information, because one day it might save your life or someone else's.